Hypnosis is a powerful tool for change. It gently guides you into a focused, relaxed state where your subconscious mind becomes more open and responsive. The subconscious is where habits, emotions, and long-held patterns are stored, and it is also where lasting change begins. Take a moment now to get comfortable, sit or lie down somewhere you feel safe, supported, and won't be disturbed. As your body relaxes, your conscious mind can rest, allowing your subconscious to do the work it already knows how to do. Over the next 10-15 minutes or so, you are giving yourself permission to release what no longer serves you and strengthen the patterns that move you forward in your life. Welcome to a new you.
At last it's time for your gastric band surgery, and already you've begun to lose weight that you no longer want or need. And to start that process, I want you to take 3 nice big deep, relaxing breaths. 3 nice big deep, relaxing breaths. And begin to notice your breathing. Notice the movement of your body as you breathe, how relaxed you feel as you breathe. And begin to start thinking about relaxing every single muscle in your body, from the top of your head, right down to the very, very tips of your toes. Relaxing your eyes, nose, ears, mouth. Relaxing your shoulders, relaxing your arms all the way down to your fingertips, relaxing every finger in turn, breathing slowly, deeply, calmly and quietly, relaxing and beginning to let go. Letting go now of all tensions, all worries, all anxieties. This is your time now just to let go and relax. Relax and letting go. Relaxing your shoulders all the way down your spine. Feeling your muscles now smooth and relaxed. Relaxing your shoulder muscles, your chest muscles. Relaxing your legs. Thighs, calves, shins, ankles, all the way down now to the very, very tips of your toes. And just picturing in your mind, if you will, a beautiful staircase. A staircase that leads down to the most perfect beach you've ever seen. Stepping down into relaxation, down to this beautiful beach. Stepping down now 10, 9, 8, 7, 6, becoming more relaxed with each step. 5, 4, 3, even deeper relaxed. 2, and 1. Standing on a beautiful beach. The sun's in the sky, and you can feel that lovely warm sunlight on your shoulders, face, cheeks and jaw. Choosing to walk down to the ocean itself, feeling the soft fine sand underfoot, allowing the ocean to lap round your toes, as it does so calming and relaxing you. Relaxed and letting go. The sounds of seabirds up high relaxes you further still, as you allow yourself just to let go of all of your tensions, all worries, all anxieties. And noticing too an old wooden bench that faces out over the ocean, And as you choose to walk over and sit down on the bench, you feel surprised and pleased just how comfortable it is. And as you sit down, feeling the soft, fine sand between your toes, think about relaxing once again every single muscle, from the top of your head right down to the very, very tips of your toes. Relaxing your eyes, nose, ears, mouth. Relaxing your shoulders. Relaxing your arms all the way down to your fingertips. Relaxing each finger in turn. Relaxing all the way down your spine, your chest muscles and stomach muscles. Relaxing your legs, your thighs, calves, shins, ankles, all the way down to the very, very tips of your toes. Relaxing every muscle, every nerve. Relaxed and letting go. And on that bench, a place of change, you noticed your left-hand side a red button and your right-hand side a green button. And if you were to choose to press the red button, it would guarantee that your life stays the same, that you're not able to lose weight that you no longer want or need. Your life would stay just as it is. However, to your right-hand side, a green button. And as you make that decision to press that green button now, that's it. You feel a wave of relaxation, because the green button represents change. Your life changing for the better. Taking control of your eating. Knowing that there will be a virtual gastric band inside you, working well for you, enabling you to lose weight that you no longer want or need. Taking control of your eating and feeling very proud of what you've achieved and what you will continue to achieve towards your goal of losing weight. And to continue that process, just know that today is your surgery. And as you think of that process and feel very relaxed and very calm, you find yourself looking forward to your gastric band procedure. And to start that process, just take 3 nice, big, deep, relaxing breaths. Three nice, big, deep, relaxing breaths. Breathing in positive thoughts and breathing out negative thoughts, leaving room for more and more positive thoughts, leaving more and more room for more and more positive, empowering thoughts. Feeling more calm, confident, relaxed and in control than ever before. More calm, confident, relaxed and in control than ever before. And as you continue to relax deeper and deeper now, you are very happy that it is now time for your gastric band procedure. You've been looking forward to your surgery. You feel calm and relaxed, and already have started losing weight as you've prepared yourself for the surgery. And you're excited that you're now eating much less and less often. And as a result, will safely and effectively get rid of any unwanted fat, losing weight slowly and steadily every day now. And you're able to know when you are satisfied. You find it easy to stop eating, even if there's food left on your plate. You're amazed at how quickly you notice that you are no longer hungry. And you are confident that this procedure is already working for you, and that your surgery will make it even easier for you to eat less and less often. You are in control. Picture the hospital reception now. The friendly receptionist has taken your details, and you are seated in a comfortable chair, waiting for your nurse. She arrives and greets you in a friendly, professional manner, and you follow her to your hospital room. It is bright, comfortable, and very welcoming. The bed is turned back, and the nurse gives you a freshly laundered gown to put on. She leaves you for a few minutes to change, but says cheerily she'll be back soon. And you are aware of feeling quite hungry. You've not eaten anything since last night in preparation for your surgery today. And this makes you feel very relaxed, in control, confident. You've already lost weight in preparation for your surgery, and you feel a great sense of pride and pleasure, looking forward to your surgery. You have changed into your hospital gown and are now sitting comfortably on your hospital bed. Your friendly nurse returns, and you feel completely relaxed as she goes through the checks she needs to do before your surgery. As you look around your room, you feel reassured by all the modern equipment surrounding you. Your nurse takes your temperature, and she smiles and tells you it's correct. She gently but firmly wraps a cuff around your upper arm. You feel a slight pressure as she inflates the cuff to take your blood pressure. Again she smiles, and she tells you that your blood pressure is perfect. Now she writes up your charts, then places a plastic bracelet securely around your wrist. She asks you to rest there for a little while. And soon, your anaesthetist arrives. He has a kind face and a gentle manner. He asks you some questions about your medical history and your current state of health. And he is very pleased with your answers and tells you that everything is perfect for your surgery to take place. He then asks the nurse to give you a small cup with some medicine in it. He explains that this medicine will start to make you feel very drowsy very quickly. And you drink the pleasant tasting liquid and settle yourself down on a comfortable bed. He tells you that when you arrive in theatre, he will be there waiting for you and give you a small injection. You will be so drowsy that you won't even notice, and you are aware of the sounds of the hospital outside your room. You are feeling totally relaxed and calm. You feel a wonderful drowsiness coming over you, relaxing your whole body. And you are aware of your nurse telling you that the hospital porters are here. They are taking you to theatre on a comfortable trolley. You feel completely relaxed and calm, indeed enjoying the motion of the trolley as they wheel you along. You reach the theatre, and you are aware of your surgeon greeting you, telling you everything is ready for you, that after your surgery, you can look forward to a slimmer, healthier future. Your life is about to change for the better. He explains that after your surgery, you will only be able to eat a small amount of food per meal. You will no longer be able to eat large amounts of food. He asks you if you are happy to go ahead and change your life, to live a happier, healthier, slimmer future. And you drowsily reply, yes. Yes. You can hear the nurses and doctors in the theatre preparing for your surgery. You can hear the sounds of the medical equipment and machines in the theatre. This makes you feel even more drowsy, even more relaxed. And now, as your surgeon is standing by you, he has a mask covering his nose and mouth. You recognize his caring eyes. You feel safe and totally relaxed. He tells you again that this is a simple procedure. It will be finished very quickly. You have nothing to worry about. And you have complete confidence in him. Your anaesthetist comes over now. He asks for your name and date of birth, and you reply in a very relaxed, drowsy voice. You feel a slight cold sensation as he swabs the back of your hand with antiseptic solution. He inserts a needle in the back of your hand, and you feel a slight pressure, no pain, no discomfort, just a wonderful, relaxed, calm feeling. You hear his voice telling you that you will soon feel even more sleepy, more drowsy than you do right now. You feel reassured by his calm, caring voice. He tells you that in no time at all, your surgery will be over. Soon you'll be back in the recovery room. And he asks you to start counting backwards from 10 to 1. And as you begin to do this, your eyes feel heavier and you relax even more deeply. You begin to count out loud. 10, 9, 8, 7. But before you get to 6, you can no longer count because you are as deeply relaxed as if you were in a deep, deep sleep. Your eyes are closed and you are deeply relaxed. Deeply relaxed without a care in the world. Your surgeon explains to his team that once fitted, your gastric band will create a golf ball sized pocket at the top of your stomach. He is using a tiny camera called a laparoscope to see inside your stomach. This enables him to place the gastric band in exactly the right position for you. Once in place, your gastric band will create a very small stomach. You will no longer be able to overeat. As your surgeon fits your gastric band in exactly the right position for you, you feel comfortable and relaxed, as if you are in a deep, deep sleep. There is no discomfort. Everything is going just as it should. You know that you are in safe hands. You know that your surgeon has successfully performed this procedure many, many times before. You are confident that he knows exactly what he is doing as you continue to relax deeply. The machinery in the theatre continues to function. The sound of the continual regular beeping of the machines makes you feel relaxed and safe. Everything is going just as it should. You know that you are in safe, skilled hands. As the nurse rubs a cold swab over your stomach, there is no discomfort or pain. As the surgeon makes his incisions, you continue to relax as if you're in a deep, deep sleep. And there is no discomfort or pain as he passes the instrument through the incisions. Now it is time for your gastric band to be fitted. The tiny camera enables your surgeon to see exactly where he needs to place your band. He is inserting your band and carefully placing it around the top part of your stomach. Now the band is in position and he is inserting fluid into the band to tighten it. He makes sure the right amount of fluid is added to make the opening just the right size. He then ensures that the pouch he has created is about the size of a golf ball. From now on, you will only be able to eat a very small amount of food before you feel totally satisfied. And now he is placing the reservoir port just under the skin of your stomach. If your band needs to be adjusted at any time in the future, this can now be done through the reservoir port, easily and painlessly. No discomfort, just a tightening that you will find very reassuring. After checking that your band is fitted correctly and is working as it should, he closes the small incisions with dissolvable stitches. The surgical team congratulate themselves on a successful surgery. You feel calm, relaxed and reassured. You know everything has gone exactly how it should. And now the nurse accompanies you to the recovery room. You are aware of the movement of the trolley as you are gently wheeled from the theatre. You notice the sounds of machinery in the operating theatre becoming quieter. The door to the recovery room gently closes. It is peaceful, comfortable and relaxing. You feel so happy and contented as you relax in these calm surroundings. You know that your gastric band procedure has been a success, and you are certain it will work well for you. And now the effects of the anesthetic is slowly wearing off. You wake up. You remember everything about your gastric band surgery. Your nurse is routinely checking that your temperature and blood pressure are normal. And after a short sleep, you are fully alert and are aware of a tight but not uncomfortable feeling in your stomach. As you slowly get up and get dressed, you are aware of a slight tenderness around the area where your surgeon made incisions during surgery. And now your surgeon comes into the recovery room. He tells you that the operation was a complete success, and you're feeling very happy and pleased that he is so confident that everything has gone so well. He explains that after a few days, you may notice a feeling of tightness in the area that your gastric band has been fitted. He also explains that it is possible that you will feel nothing at all. Either is completely normal. He tells you that in a few hours you will be able to return home. Your nurse returns with some food and drink for you, and you are surprised at how comfortable and in control you feel as you eat the food. It is a very small portion of food, but you feel satisfied completely. It is a wonderful feeling to know that your gastric band is working correctly. You know that from now on you will only be able to eat small amounts of food. You're feeling pleased and confident that you will easily lose all the excess weight and become slimmer and healthier. From now on, you will eat small portions of healthy, nutritious food. After a small amount of food, you will feel completely satisfied. You will find it impossible to eat once you realize that you are no longer hungry. Every time you eat, you chew your food thoroughly, savoring each mouthful. You eat slowly and mindfully, quickly recognizing the signal that you are no longer hungry. From today, you feel a huge sense of pride and pleasure every time that you refuse the opportunity to eat more than you need. You will find it impossible to overeat, stopping as soon as you feel satisfied. Feeling relaxed as you leave any unwanted food on your plate. And as you eat less at each and every meal, the weight begins to drop off you. You're becoming slimmer, fitter, and healthier each and every day now. You notice that your clothes are becoming looser and looser. You find that you have more energy, it becomes easier for you to exercise. And you're enjoying every day, feeling in control and confident that your gastric band is working for you. Because your stomach is so much smaller, you are aware of a feeling of tightness. Each and every time you feel the tightness in your stomach, you feel happy that your gastric band is working so well. You are successfully losing weight, successfully getting rid of your unwanted fat. Your gastric band is helping you to take control of your eating. Every day now, you eat smaller amounts of food and eat less often. And you are losing weight that you no longer want or need every day, becoming slimmer and feeling really proud of yourself. And as you lose more weight, you become more interested in exercise. This in turn increases your weight loss, making you feel confident and in control. And every day you get closer to your goal weight. You are really enjoying your weight loss, feeling proud, confident, and in control. And that feels just right. That feels just right. And now in your own time, counting up in your thoughts from 1 to 5, coming all the way back, fully refreshed, fully alert, back to here and now, back to the day and all those good days ahead, looking forward to your life, a healthier life, a life where you are slimmer, fitter, and healthier, feeling more and more in control every day, feeling just right every day, and saying to yourself every day in every single possible way, I'm getting better and better. Every day in every single possible way, I'm getting better and better. Counting up now, 5, 4, 3, 2, and 1. And in your own time, with a big smile on your face, eyes open all the way back, looking forward to the day ahead, the week ahead, looking forward to your life. Welcome back.
I hope you enjoyed this session. The changes you've begun today don't stop here. Your subconscious mind will continue to integrate what is useful, quietly supporting the positive changes you want in your life. If you are ready to go deeper, we offer personalised one-to-one hypnotherapy and counselling sessions here at OLIP Therapy, either online or in person. Use the link in the description below to visit our website, where you will find a whole host of resources and things to help you in your life. Take the next step and reach out today and start the transformation you've been ready for. Welcome to the new you.